Hi Misties, I'm Taylor. I'm doing my mastery checkoff. I have my scenario right here, my MAR, and my medication information about labetalol. Okay. My patient, Thomas Moore is a 27-year-old male admitted with complications from an umbilical hernia. He has a PICC line that is saline locked. Vitals were just taken and his blood pressure reading was 182/86. The orders are to start D5 half normal saline IV at 100 milliliters per hour and labetalol 20 milligram IV push PRN for blood pressure of over 170/90, which that's what he has. So we're going to go ahead and do that. He has no known drug allergies. Go ahead and get started. Okay, so I have labetalol, 20 milligrams. I'm going to give it, push it into his PICC for 4 milliliters into his PICC line, and I'm going to push it over 2 minutes. It's an alpha beta blocker. It controls blood pressure. Some adverse effects are dizziness, nausea, and possible somnolence. So I'm going to monitor his blood pressure and keep the patient supine due to possible postural hypotension. The infusion rate is D5 half normal saline at 100 milliliters per hour. The bag looks pretty good. There's no punctures. Expiration dates on both look good. I'm using a 5 ml syringe with my blunt tip. Okay. Trying to gel up the meds really quick. Clean for 15 seconds. I have a trash can right there. So 4 mLs. Air to air. Pull that back. Get rid of any air bubbles. There we go. Okay. Perfect. And okay. Okay. Alrighty. I'm also going to make my drug labels really quick. Alrighty, I have labetalol. How do I spell that? 4 mLs. With the date and time as well. there. Okay. And then we have D5, half normal saline at 100 mLs per hour with my initials. Okay. And I'll put that on the tubing when I get in the room. Okay, but I am ready to enter the patient's room. I've gathered all of my supplies, I verified my doctor's orders, and I'm ready to go. Or actually first I'm going to double check everything to my MAR. I have my D5 half normal saline, which I will put the label on when I get in the room. D5 half normal saline, 100 mLs per hour, 100 mLs per hour. Then I have labetalol, 20 milligrams IV push as needed for blood pressure greater than 170 over 90. So that's 4 mLs. Up there. Okay. I am ready to enter the patient's room. Okay. I've gathered my supplies, double checked my doctor's orders. I've done my second med check. I'm ready to go. Knock, knock, knock. Closed door for privacy. Hand hygiene. Hi, Mr. Moore. My name is Taylor. I'm an ACC nursing student. I'm going to be giving you your meds today. Can you give me your name and date of birth, please? Okay. Mr. Moore, Mr. Moore. Alrighty. And do you have any allergies? No allergies. Alrighty. I'm just going to double check your MR number really quick. And I'm also going to check the IV site for inflammation and infiltration. And everything looks good. Okay. Go ahead and get you all set up here. Trash can right there. Okay. Keeping all ends sterile. I'm going to untangle this. Make sure the clamp is closed. Okay. I'm going to aseptically spike the bag. Labeling. Alrighty, I'm also going to flush the line for any air bubbles in here. First I'm going to squeeze the drip chamber, get that about halfway full. I'm going to try to keep this facing up, this first Y port. It doesn't really want to stay up. It's about halfway full, so now I'm going to take this off aseptically. Okay. Might have to squeeze the bag a little bit. There we go. There we go. Get rid of all those air bubbles. bubbles gone. And I'm going to aseptically recap that. Just hang that for a second. Okay, alrighty. Mr. Moore, I have your drugs for you. Like I said, I'm going to first start by, I'm going to aspirate and then flush, but I have your labetalol, it's 4 ml of labetalol. It's going to help control your blood pressure. You might experience some dizziness or nausea, but I'll be back in to check on you, like I said. I'm going to push it over 2 minutes. But first, I'm going to clean this for 15 seconds, your port. Okay. Get rid of any air bubbles. There you go. Okay. I'm gonna aspirate just to make sure I'm confirming location. I'm gonna aspirate for blood return. Okay, there we go. And now I'm going to flush using the push pause method. There we go. Alrighty. So here's your labetalol, or actually, I'm going to scrub this for 15 seconds. Okay. And I'm going to push this for 2 minutes. Your 4 mLs for 2 minutes. Got about a minute left. Okay, almost there. Okay, that's about 2 minutes. Now, gonna flush one more time. Okay. Keep the air bubbles out. There we go. Going to flush the first 3 mLs for about a minute. Just because there might be some leftover meds in there. Almost a minute. Now I'm going to do the rest using the push-pause method. Alrighty. That will go on the sharps. Okay, now I'm going to give you your D5 half normal saline. And I'm going to run it about 100 milliliters per hour. Okay. Okay, there we go. Alrighty. Trash. Okay, Mr. Moore, that is all for today. Can I get you anything? Are you comfortable? Are you in any pain? Do you have everything you need? Do you have to go to the bathroom? Okay, great. Here's your call light. Press this button if you need anything and I'll come running. I'm going to lower the bed to the lowest setting, raise the bed rails, and I'm going to do hand hygiene, and I'm going to exit the room. Now I'm going to document my 8 rights, which is I have my right patient, my right medication, my right dose, right time, right route, right reason, right response, and right documentation. Okay.